Hello everyone. In previous part we discussed what is risk factors and its types with examples. In today's video we will be discussing risk assessments and protective factors. Health risk assessment. How to assess a risk? First of all, we have to identify the hazards and the risk factors. Which are the risk factors or hazards are present, which can be identified with the help of like case control and cohort studies. Then second steps would be analyzing and evaluating. So first of all, dose response assessment. What is the relationship between exposure and the effect? What is the relationship between the high dose and the outcome? For example, people might be smoking 1 to 2 cigarettes per day, or sometimes people might be smoking a whole packet throughout the days. So if the people are taking more cigarettes, smoking more BDs, then they are at higher risk of getting cancers. That is known as dose response assessment. Exposure assessment: frequency, timing, level of contact. So frequency, timing and levels means, suppose if someone start drinking from today or from tomorrow, whether they will develop cancer or not, what is the possibility? If someone starts smoking from today, what is the possibility? Similarly, what is the possibility of developing cancer if someone has smoked for 10 years, 15 years, now they are ready to stop from today? What is the probability? So that kind of exposure assessment has to be studied. Then at the last, risk characterization, summary of an overall risk or the conclusion about the risk, which can be done by relative risk, odds ratio, attributable risk and population attributable risk. More about this all measurement in some other day. Risk control. How to control risk? Elimination of the hazard or behavior change. If the person or the people or the group of people is having particular hazard or the risk behavior, then we can suggest them to modify that behavior. For example, sedentary lifestyle. We can encourage people to start exercising. Substitution of hazard with those of lower risk. So if the hazard is present, then we can substitute the other chemical or substance. Isolation of the hazard. If the hazard is present, then those kind of things or the activity can be done in the isolated environment. Engineering approaches to the hazards. Mechanization. Redesigning a process to place a barrier between the person and hazard. Administrative approaches to the hazard, like the decision taken by the policymaker or by the health administrator by increasing the taxation on tobacco products. That is the example. Uses of personal protective equipment. We have so many personal protective equipment ranging from the boots, gloves, helmets, spectacles, and so and so. Protective factors. Which are the protective factors? We have already discussed the risk factor. So opposite of that are the protective factors. Physical activity. We are going to talk about the two most important protective factors. One is physical activity and other is the diet or our nutrition. And we are not going to talk about in detail regarding physical activity, but we will be highlighting the most important point, and that is the exercise. How much exercise one should do to prevent or to modify their sedentary lifestyle or protect themselves from developing the many non-communicable diseases. Globally, 1 in 4 adults do not meet the global recommended levels of physical activity. People who are insufficiently active have 20 to 30% increased risk of death compared to people who are sufficiently active. More than 80% of the world's adolescent population is insufficiently physically active. Now question arises, how much physical activity one should do so that they can be labeled as physically active enough. As per the WHO recommendation, at least 150 to 300 minutes of moderate intensity aerobic physical activity should be done by the adults. So which comes around 20 to 25 minutes to around 50 to 60 minutes per day, 6 days per week, or at least 75 to 150 minutes of vigorous intensity aerobic physical activities, which comes around 10 to 15 minutes to 25 minutes per day, 6 days per week, or an equivalent combination of moderate and vigorous intensity activity throughout the week. Do muscle strengthening activities at moderate or greater intensity that involve all major muscle groups on 2 or more days a week. Limit the amount of time spent being sedentary. So break the momentum. Again, the another important thing is diet. So what about the diet? So when we are talking about diet, it's advised that food pyramid should be followed. So exercise regularly and physical activity along with that appropriate diet. Abstain from drinking alcohol and say no to tobacco. And whatever we are eating, it should be in proportion of this food pyramid. So the whole grain, milk, rice, it should be consumed adequately. It should make the larger portion of our plate. Eat liberally. Green, leafy vegetables and fruits should be eaten liberally. It should make a large part of our dish. And whenever possible, it should be eaten as a fresh. All the non-vegetarian food, oils, ghee should be eaten in moderate amount. And eat sparingly. Means you should only have occasionally all the junk foods like burger, pizza, and many other things like bakery products that should be taken once in a blue moon. Another way we can advise about the diet is according to stages of life. For growth and appropriate milestone to achieve during the childhood, breast milk, energy rich foods, fat, sugar can be consumed. It should be consumed in large amount. For the growth development and to fight infections during the child's development, energy rich bodybuilding and protective food like milk, vegetables and fruit should be taken in much large amount. For growth spurt, maturation and bone development during the adolescent phase, bodybuilding and protective food should be consumed in adequate amount. In stages like the young and middle age, for maintaining health, productivity and prevention of diet related diseases and to support pregnancy lactation, nutritionally adequate diet with extra food for childbearing and child rearing. And during the middle age and the later part of life, you should be very careful whatever you are eating for being physically active and healthy. Nutrient dense, low fat diet food should be consumed. Understanding and managing risk factors regarding diabetes, heart disease, and cancer is paramount. By addressing modifiable risk factors such as diet, physical activity, and smoking, we can significantly mitigate the likelihood of this debilitating condition. Genetic predisposition may play a role, but proactive healthcare, regular screening, and early detection strategies offer a crucial defense. Collaboration between individuals, healthcare provider, and policymaker is vital to implement the effective preventive strategies. Ultimately, empowering people with the knowledge of risk factors is the cornerstone to build more healthier and resilient communities. Thank you.